Dr. Kelly Wilson with AAOMPT, and I'm very excited to bring to you my 1-hour lecture, The Global Diaphragm. We're going to be looking at postural considerations and how things can be impacted from the throat all the way down to the pelvis, and how this inefficient system can predispose your patients to low back pain, urinary incontinence, voice dysfunctions. You know, it's not just about the breath and the diaphragm, but we need to look at that 3-tier system all the way from our glottis down to our pelvic floor and look at our patient and see if there is a dysfunction involved or some sort of incoordination. Because if there is something present, that could be the driver for their low back pain. That could be the driver for their urinary incontinence or their slowly weakening voice. So we're going to take a step back, look globally, and look holistically at the patient. And by the end of this 1-hour lecture, you're going to have some simplified exercises and understanding with our hands-on instructional lab on how to cover and approach this topic with your patient population. I can't wait to see you there.